Good morning and welcome everybody to our first childhood bronchiectasis question time webinar. We do hope you will find this webinar useful. I'm Professor Ami Kantar and I'm the head of the Pediatric Asthma and Cough Center in Bergamo, Italy. I'm one of the question hosts for today. And before I ask my co-host to introduce himself, there's some information I need to tell you. If you want to use the Zoom automated translation captions, please click on the show captions icon on your Zoom toolbar. If you can't see it, click on more icon. In the pop-up list, move the translation slider to the right, click my captions language and choose your perfect and preferred language. We know that automated translation is never perfect. Some words may be muddled, but we hope it helps. If you need any problem, if you have any problems and you need to assess captation, please email info@europeanlang.org and a member of the ELF team will help you. This event is a webinar, so we'll not be able to see you. You can see us and you can see the panelists. We can't hear you. We want you to get involved anyway. So we'll be answering and asking the questions that have been submitted in advance to our panel of experts who will meet us in a moment. If you have any follow-up questions, please put them in the Q&A box. And if you have time, we'll answer them today. If we don't have time to answer all the questions, then we'll try to get answers from the experts after the event and put them on our website. Please remember that we can't answer questions about anyone's personal circumstances or cases. If you use the social media, then feel free to keep using the hashtag childhood bronchiectasis and tag ELF. You can see them on this slide. This webinar is being recorded and will be made available on the ELF website next week. So you can and others can freely access it later. Now I would like to hand over to my co-host and to introduce himself. Please, Ed.
Hello, thank you, Ami, and hello to everyone watching and listening. My name is Ed Powell. I'm from the UK and I have had bronchiectasis for the last around 10 years. I was diagnosed at the age of 8 after first showing symptoms at 5 months old. So I'm now 17 and I have worked alongside the ELF since 2022, most recently becoming an ELF council member last year, and I'm also the chair of the ELF Youth Group. So I think now that you know both me and Ami, your two co-hosts, we should now get started, and I will first start by asking our panel of experts to introduce themselves. So first is Zina.
Hello, my name is Zina and I'm actually Ed's mum. I have worked with the ELF since 2019 as a parent-patient representative on various task forces and CRCs and clinical research projects regarding non-CF childhood bronchiectasis. And most recently, I have become a member of the council.
Next is Pam.
Hello, I'm Pam Laird and I'm from Perth in Western Australia. And I'm a children's pediatric respiratory physiotherapist. And my area of work is mostly non-cystic fibrosis bronchiectasis. I'm very passionate about seeing if we can find ways to detect it earlier and have much better outcomes for kids. So that's me. I'm also mum of 3 children who had bronchiectasis. So I've got a bit of a lived experience as well.
Angela.
Yes, hello everyone. My name is Angela Zakharastovic. I'm a professor of pediatric respiratory medicine and I work in Vienna in Austria.
Laura.
Hi, I'm Laura Petrarca. I'm a postdoc researcher and pediatric pulmonologist at Sapienza University of Rome.
So I'm now going to move on to our first question, which is for Laura. So what is the cause, or what are the causes of childhood bronchiectasis?
Well, bronchiectasis is a long-term condition in which the airways in the lungs become large and dilated and accumulate mucus. And apart from cystic fibrosis, which is a common cause of bronchiectasis in children, other causes of bronchiectasis include repeated pneumonia and lung infections. Some conditions that accumulate mucus inside the lungs, such as primary ciliary dyskinesia, or some conditions that make the child more prone to have infection, such as immunodeficiencies, or repeated aspiration, or condition in which there are some communication between the respiratory tract and the digestive tract, such as tracheoesophageal fistula, or some cases in which there have been foreign body aspiration that becomes stuck in the lungs and causes local airway injury, or a condition in which there is an abnormal inflammation, such as rheumatologic diseases or autoinflammatory diseases. These are the most common causes, but in some cases, a clear cause cannot be recognized. And so we define it idiopathic. So we cannot know, we don't know exactly what is the cause of bronchiectasis.
Okay, thank you, Laura.
Okay.
We'll go ahead in order as we have received these questions. And the next question is to Angela. My child was born 3 weeks early. Could this have been a reason for bronchiectasis?
Well, being born early might cause some problems, but bronchiectasis is really symptoms of chronic wet cough. And this isn't caused only by being born a bit too early. It's other reasons, like Laura has already told us. It's if when the lungs are chronically infected, there's an inflammation and there's a vicious circle of inflammation and infection. And this causes this chronic wet cough. So if your child has got chronic wet cough for more than 4 weeks, it needs to be investigated, and we need to try to find the reason, because for some reasons there's also treatment. Like, for instance, if the immune system isn't working quite properly, then in some cases there's treatment. We can give immunoglobulins, for instance, and this can help and improve the bronchiectasis. And if we treat them early, we can prevent deterioration and sometimes even make them go away again. So being born a bit too early isn't a reason for bronchiectasis.
Thank you. So Laura, could there be a hereditary link or genetic link for bronchiectasis?
Yes, this could be it could be a link between genetic condition and the development of bronchiectasis. As I told you, there is a disease that is called primary ciliary dyskinesia, in which there is an impaired movement of the cilia that are in the respiratory tract. So when the motile cilia that doesn't move properly, there is an accumulation of mucus, and the respiratory tract is more prone to have infection, and this infection leads finally to bronchiectasis. But also some cases of immunodeficiency are genetic based, and also the alpha-1 antitrypsin deficiency can lead to bronchiectasis in the childhood age. Okay.
Okay, thank you, Laura. And one more question for you. And this is about vaccinations, and we know the importance of vaccination for our children. And the question is, I haven't been given any vaccinations. Could this be the reason for my child's lung disease?
Well, if I well understand, it's the mother that didn't receive the vaccine. Okay, so there is there isn't a clear link between the maternal vaccination status and the development of bronchiectasis in the offspring. But what is known is that it's repeated lower infection in the child is a condition that make the child more prone to have bronchiectasis. So vaccination is really important for the child to avoid this repeated infection when possible, when we have a vaccine available to prevent the disease, the infection. Okay.
Thank you. We're now going to move back to Angela. So a person lives in a damp and moldy building and they were wondering if that could cause bronchiectasis.
Well, housing conditions are, of course, important, and moldy, damp living environment is not healthy for anyone. And it can cause, in some children, chronic infections, or the likelihood of having infections will increase. And any infection that is prolonged and doesn't get treated properly can initiate a circle of infection, causing inflammation, causing problems. And sometimes also children have hypersensitivity, a certain problem with mold and dampness. For instance, children with asthma will often have problems with damp environment, and there can be also a link that increases the risk of suffering from bronchiectasis. So yes, avoid moldy and damp housing if possible, and also avoid other things like passive smoke exposure. That will be very important, that any child just breathes clear air.
Oh, I think the second question is linked to this argument. And this my partner smoked while I was pregnant. Could this be a cause of bronchiectasis? And I think that smoking and vaping is something that we must fight against. And this question is for Laura. Please, Laura.
So the fetal lung is very sensitive to tobacco smoke exposure. So I think it's important to strengthen the message that we should avoid the smoking exposure for pregnant women, and but there is no clear evidence in literature regarding the prenatal smoke exposure and the development of bronchiectasis later in life. There are some evidence for other chronic lung conditions such as preschool wheeze and asthma that are in some cases that are lower airways infections. So we don't have a clear direct link, but it is important to strengthen the message that smoke exposure during pregnancy can cause a higher probability to have this condition, so asthma and preschool wheeze, and this condition make your lungs not healthy, and so I would strengthen the message to avoid smoke exposure both in pregnancy and especially later on in life, because what is known is that after the child is born, is really a risk factor to expose him to smoke, tobacco smoke, and other pollutants. So it's better to start to avoid smoking also before the child is born.
I think, Laura, you think the same thing about vaping, isn't it?
Sorry?
About vaping, also vaping, you don't recommend vaping, not only smoking.
Yeah, of course, not, not smoke when you have a baby. So start when the pregnancy is going on is a good start.
Thank you, Laura. So our next question is also for you. This person's heard that some childhood bronchiectasis is reversible. Is that true?
Well, in some cases, mild bronchiectasis may be reversible if treated at an early stage. This is true especially in early diagnosed and cylindrical bronchiectasis, which is the very early stage of bronchiectasis. So it's important recognize very early bronchiectasis. So investigate all the children with chronic wet cough for the presence of bronchiectasis, and treat them early and appropriately, because in some cases this process can be reversible. And even if the bronchiectasis do not revert, it's important to recognize it early, because the early recognition and the appropriate treatment can halt the lung deterioration, and avoid further infection, can reduce the probability of bronchiectasis to progress. So it's important to reduce all the other insult to the lungs. So this is the final message. Can be reversible, but in some cases, but it's important the early diagnosis, because can reduce the damage progression in this child.
Maybe the same question for Angela. In your experience, do you have such patients that have some reversed bronchiectasis, and how you think they will manage such patients, and when they will manage, maybe the question.
Yes, well, if they're managed as early as possible and treated aggressively when they have infections, and if they get the right treatment, a lot of physiotherapy to reduce their mucus and clean their airways, as they grow older, the body also has some healing abilities. So with the growing of the child and an active lifestyle with a lot of exercise and the right kind of treatment, we can hope that we can stop progression and sometimes even reverse the bronchiectasis, which is wonderful, and that should be our goal, to reduce symptoms, treat early, and really try to avoid any infection, especially if it's going on for a longer time. So parents, doctors, and patients should be aware that if their symptoms increase and if they have mucus, they should get rid of it, they should treat it, and they should clean their airways, because that's the best way of reducing and reversing the bronchiectasis.
Angela, do you think you could talk a little bit more about what a patient should do specifically to try and help the reversibility process? I know you were talking about some other things in terms of like physiotherapy. Do you think you could elaborate more on that?
Yes, well, first of all, it's good if they're aware of their symptoms, and every patient is different, and every patient's bronchiectasis will also be different. And children and adolescents will hopefully learn to listen to their body and know when something's going on. And this awareness is also something that parents will have. So we as doctors need to listen carefully to what the patients are saying, what the parents are saying, whether the symptoms have increased, for instance. So any increase in symptoms, sometimes only subtle signs like loss in appetite or weight loss or things like that, or energy loss, might be a sign of a flare-up, an exacerbation. And this is something that we want to treat as early as possible in order to prevent damage within the lungs. So having this awareness, all of us, is really important in the treatment of any child or any person suffering from bronchiectasis.
So Angela, once more, just to add some more information about this argument, you have been talking about the role of infection in bronchiectasis, and the question is, if my child CT scan shows that bronchiectasis is reversed, should they be still treated aggressively if they have infections?
This is a difficult question, actually. So I think if a child has had bronchiectasis diagnosed sometime early in life, this is a subtle sign for me that we have to be really careful in this child and treat early and aggressively. So the situation that this child will have had another CT where there aren't any bronchiectasis anymore, this is actually a situation that we don't find so often, because repeated CT scans aren't done so often. Because of course this is radiation, this is not something that we do repeatedly easily. We want to avoid radiation. So very often we just have one CT of this child. But in case we have more CT scans and bronchiectasis have disappeared completely, which is a great situation, of course, I'd still be careful, and I'd still sort of listen carefully to whether any symptoms reoccur, or whether the child again might have an episode of chronic wet cough for more than 4 weeks. Then I would be very, very careful.
So I mean, cough would be a symptom of alarm for...
Yes, wet cough, exactly. So chronic wet cough will also be will always be an alarm sign for us. Mm-hmm.
Thank you. So my next question is for Laura, and then if you wouldn't mind jumping in maybe with some thoughts as well. So the question is, how are the lungs able to renew or repair when bronchiectasis has been caused by an acute infection? So like the lungs have been healthy until a virus or bacteria has damaged them.
Well, it is known that at birth, the lung development is not completed, but lungs conclude their development after birth, during childhood, and also during the adolescence, even if at a reduced rate. So this ability to grow is possible the basis of the pulmonary healing after an infection or an insult. Yes, the lungs are able to regenerate, but this fact is related to the time when the insult happens. So the earliest, the higher the probability of renovate, and also related to the type of insult. And these two factors are related to the probability of renewal and repair after the insult.
Okay, thank you, Laura.
Thank you.
We'll go ahead with other questions now, and the question is a very important question. What is the best treatment for bronchiectasis?
Oh, I think Pam should...
I think you covered that beautifully.
Okay.
Yeah.
If you want to add something,
I don't need
Pam to answer it. Okay.
No, I can add later on with the physiotherapy. That's good.
Okay. Okay. Okay, so we can move. Okay.
You can start, Pam.
I think. Oh, okay. I probably don't have a lot to add, except that the airway clearance is something that can help in the lungs healing. So the body is amazing the way that it can recover when someone has had a bad infection, like a pneumonia or bronchiolitis. The little hairs will grow back, so the cilia. That can take quite some time for that to grow back. But if someone does have bronchiectasis, then by doing airway clearance, so the chest physiotherapy, that can help get that mucus out, which is really clever. And the amazing thing about the airways is there's these little backdoor channels where if there's a little plug blocking that airway, by doing the airway clearance, especially if you're doing something like positive pressure, that back pressure can push the mucus out, so help the body's natural defenses, if you like. So that's something that will also help the body heal, as well as the doctors prescribing antibiotic medicine if that's required as well.
So, Laura, have you something to say about treatment?
Oh,
The basis of treatment, I mean.
The basis, yes, the basis of treatment. There are some specific treatment in specific cases, but there are some general measures that are able to prevent exacerbation, which is the goal. One of the goals of the treatment. So first of all, check the vaccination status of the child, which is really important to prevent possible preventable infections. Another thing is the nutritional intake. So it is really important to avoid malnutrition, both in quality of nutrients and in the amount of calories intake. And check carefully the vitamin D status of the child. It's important to encourage to start the physical activities in these children, especially outdoor, to help with the airway clearance also, and on the other side, to help the lungs to stay healthy. Avoid the tobacco smoke exposure, the exposure to pollution and allergens. Avoid further infection, especially avoid the close contact with the people that are ill or that has flu symptoms. So promote hand wash and the use of face mask if someone at home is sick. These are the general measures to avoid the exacerbation, but once an exacerbation is established, it's very, very important to be able to recognize early the exacerbation and treat appropriately to avoid the further damage of the lung. And I think that another crucial point is the lung clearance through physiotherapy. So I think that, Pam, if you want to add something about that.
Yeah, so, and again, I think like Laura said, and also Angela, it's everybody's bronchiectasis is different. So I think the key thing is having a good relationship with your physiotherapist and your treating doctor so that you are really clear what that team want you to be doing. But as a general rule, we would often, if children, some children do their airway clearance every day, no matter what, whether they've got a wet cough or not. And that's often in children, say, if they've got the primary ciliary dyskinesia, so when the little hairs don't work properly. So those children will always need to do their airway clearance. In other children, sometimes the physiotherapist might say they only do it on the very first day they get a wet cough. And then how long do they keep going for? They will often be asked to do it for at least 2 weeks once that cough gets better, once it's gone away, to make sure it's gone away. But again, it really does depend on the child. So it's hard to give general rules. And if you are sick, usually it's done morning time and night time to do the airway clearance. And yeah, so that's probably just some quick general ideas. And then definitely the exercise is important. I'm very much a believer that the exercise is good for the fitness of a person, but it's also really good for the mind. And I think having the effects of exercise are so good for mental health, and then that's going to have a good effect on your overall well-being as well. So you're sort of doing two things at once.
Excuse me, Pam, is there any preference in choosing the lung clearance in this case? Just one question.
Yeah, so that is a really great question. In terms of, is one technique better over another? The research does not actually tell us which one is better than another one as a general rule. I think the most important thing is that it's tailored for each child depending on what's going on for them. So if a child's got very floppy airways, where the breathing tubes are very floppy, we know they benefit much more from what we call PEP therapies. So when they're breathing out against a resistance. So often children will be given that if they've got very floppy airways. So again, it's just dependent on what's going on for that child, what's causing it, and then what's more effective. And not just that, because Zena will probably say it's also, and Ed, what the child likes doing, because then they're more likely to do it if it's something that's not horrible to them. So each child has a different preference for what they like. So we'll often play around with some different things till we find what works. Might be helpful for Ed and Zena maybe to add something to that.
Yeah, I would agree absolutely that, and it changes as they get older as well. And so certain things will work and certain things don't. But it's just trying to find what they will do happily. And like talk about the PEP devices. Sometimes that's a case of sitting, watching TV, or and doing that. Then it's just trying to find what and exercise absolutely. Our case, yeah.
Yeah, I think I'm just echoing what Zena and Pam said. I think exercise for me has been really important in both helping to clear mucus when I started doing intense exercise like running a lot. Also it helped mentally the burden of treatment can sometimes be quite high, especially with bronchiectasis. If you're going to have physio and then go to the doctors to have treatment with drugs, I think it can be quite a big burden. So exercise for me helped me both, like Pam said, physically, but also mentally to help me through.
Yep. And then probably the other quick thing is you might find that your physiotherapist changes the treatment as the child gets older, and that's because the airways are changing. And so you might start when it's a little baby doing the percussion, and then it might move to a device later on. So it all depends on the development of the child, their ability to think or take deep breaths. So there's lots of things at play. So that's why it tends to change as time goes on. So it's really important to have regular reviews with your physiotherapist so that they can progress things as they need to.
Angela, if I can just quickly circle back, do you think you could talk about asthma inhalers? Because this person has said that they've heard that asthma inhalers aren't effective or recommended for people with bronchiectasis. And is this correct, or what? And why or why not?
Well, asthma is a different disease, first of all. Okay, asthma is also a chronic inflammatory disease, but it really needs different treatment. Sometimes a person might suffer from asthma and bronchiectasis, in which particular case they will have to also use asthma inhalers. And sometimes asthma inhalers are used to open up the airways before you do a certain type of physiotherapy. So there's not a complete no for asthma inhalers. But what is important is that quite often children are not diagnosed yet with bronchiectasis, but they are constantly treated with asthma medication, which doesn't work quite well. And they keep on having symptoms, often the symptoms of chronic wet cough. Whereas asthma really is much more often a dry cough. So it's a different type of cough. And this can be misdiagnosed. Okay, so this is why typical asthma inhalers are often not effective. Treatment-wise, what we haven't said before, I've just sort of mentioned it on the side, is that antibiotic treatment is a major, very important part of treatment of bronchiectasis, and this will also be different. The duration will be longer. So we need to treat for longer periods of time with antibiotics. This is really essential, so I wanted to mention it right now.
Okay, so go back to Pam. And there's one question about the compression vest. Is it useful? It's harmful in bronchiectasis?
That's a good question. It's generally not recommended, the vest, in a child that doesn't have a neurological condition. So if it's a regular healthy child, there's not a lot of evidence, but the evidence that there is showed that those children didn't do so well. So we will generally not recommend the vest. And the other thing is it's very expensive, and it doesn't require the child to do anything active.
Okay, we'll just step to very similar question, this one. Do you have any advice for encouraging good airway clearance? And this is for Zaina too and Pam. We said something late before about this argument, but besides antibiotics, we should think about helping these patients in other ways, not only with pharmacological treatment.
Absolutely. And I think it's trying to find what is effective for the child and what the child will actually engage in. And we found that when Edward was very little, you know, bouncing on the ball to try, you know, a gym ball, he didn't like that. It was really hard. He didn't particularly enjoy the percussion when he was very, very small. So for us, it was trying to find things that he really wanted to engage in. And we found cycling. He loved to cycle. He loves to run, although that's been hard work. You know, when he started a few years ago doing a couch to 5K, where you start from no running at all, and at the end of 7 weeks or so, you could be able to run 5 kilometers. That was actually really, really tough because it took a long time to clear his airways of mucus. So he'd be going on you know, on those first runs for those first few weeks, and he was having to stop and bring up mucus and then carry on and stop and bring up mucus, and it was quite difficult to keep him going, but he did because he wanted to get the reward at the end for doing this for school. So it's just trying to find what they are active in. Now he can run 5 kilometers, no problem. He used to play squash. He runs and he also cycles a lot. And so it's those things. It's trying to find things that they enjoy. Singing as well and playing the trumpet. All, you know, he does them all. So he's leading a very active life without it looking like he's doing physio, if that makes any sense. But he will do physio. As soon as that cough starts, he will almost stop doing those physical things because sometimes that's too difficult or it's whatever. And then he will start doing the physio. With him, it's a small device called NoPep. That's where he will start doing it.
So just like Zena said, definitely trying to find what works for that particular child. It's like many things as a parent. When you're if you've got a very young child, you start small. So we will often use timers, and we might only try and do 1 minute at a time. We might put up with a little bit of grumbling, but not a lot of grumbling. And then we slowly try and increase the time. When kids are little, we do things like sticker charts and try and have a little reward system, and popping charts on the fridge so they can tick off and give themselves stickers. So lots of incentive things like that have been helpful. Also, waiting for their favorite TV show to come on or having an iPad with their favorite things. So if you're doing the pats so they can be distracted, singing music, songs and nursery rhymes and things at the same time. And then that obviously changes as they get bigger. And then I think the other key is really making sure that you're bringing that mum and the child on the journey with you so they understand what they're doing, why they're doing it. And so I often use the analogy of brushing the teeth, and we don't want to get holes in our teeth, and it's the same thing with the lungs. So really trying to get families to understand exactly what's happening, because I think when that understanding's there, the motivation's going to be better.
You know, some parents are worried about that this may increase their coughing. Is this true or not true? What do you think about this? That increase
what? Sorry, I missed that.
In these patients, on these subjects, that this may increase their cough during exercise. Is this true?
Right. It's a great question. Do you want me to answer that or?
Yeah.
Yeah, okay. So you can get increased coughing if you're exercising, but physiotherapists can also teach the child how to control the coughing. So there's lots of techniques that you can learn from your physio to help learn how to control that. So some coughing is good. We want that because we want to get the mucus out, but we don't want that spasm type coughing that happens. So if the if the child's experiencing that, it's really important to try and understand what's going on. So is it that they're getting a little bit of, as Angela was talking, like an asthma component that they might need to get looked in, or is it just something else at play? So it's just trying to figure out what's too much coughing, and what we can address, versus we want them to cough because it's good to get that mucus out. I hope that's answered it.
Thank you. I can't hear you, Ed.
You're muted, Ed.
Sorry. Pam, do you think you can maybe echo back to what you were talking about before about doing respiratory physiotherapy when there isn't an exacerbation or a wet cough, and what your advice would be there around not specific cases, but what your general advice would be?
Yeah. So as a general, again, if it's something where, like the cilia problem, they need to do airway clearance all the time because the little hairs are not doing their job. If the doctors are fairly confident that what's going on is, if it's not an immune problem that's causing it, then once that child's better, they can probably focus on exercise and sports and just living a good life. But again, you must listen to your physio and the doctor with what's going on there. So I think, has that answered the, I think I might have forgotten the question a little bit. So if you're well, hopefully you might not have to always do the physio. But we would recommend, as soon as that, don't wait 4 weeks with the cough being wet, start day one, because hopefully that will stop it even turning into an exacerbation. That's probably what we would recommend if you do have bronchiectasis.
Okay, I'm going back to Angela. And as you mentioned before about antibiotics, and the question is, when you start with a wet cough, if your general condition is good, do you need to take any treatment, or you must wait for other symptoms, before starting antibiotic? What do you think about this? I know that sometimes we use them for prevention, sometimes for treatment.
Yes.
Acute phase, please.
If we're talking about using antibiotics as treatment, of course, children have lots of infections, lots of viral infections, especially when they're young. So if the child's really well, we increase physiotherapy, we increase inhalations, and depending also on the reason of the bronchiectasis, we might wait a few days. So in our guidelines, we've said 3 days if the child's well, if the symptoms aren't so bad. Then we can wait approximately 3 days, but then we should start treatment with antibiotics. If the cough's still there, if the cough's wet, if the symptoms increase, and if it's a flare-up, an exacerbation. Obviously, also that can happen really quickly, and the child might suffer from severe bronchiectasis and then might already need supplemental oxygen and a hospitalization and treatment with antibiotics over the veins, so IV, because it's so bad. Then we need to treat immediately, of course. So it will depend on the specific situation, the specific child, and the reason for why the bronchiectasis are there in the first place. But as a general rule, I would say 3 days. If the child's still well and doesn't have severe symptoms, it's about 3 days. We can wait and see what's going on, increase physio, and see what's happening.
Many doctors use also sputum in
Yes.
managing these cases. What do you think about this?
Yes, it's important how the sputum looks like, whether the secretions are increasing, what color they have got, which is also the reason why we want to see patients on a regular basis and also do a testing of their sputum and to see what bugs are inside the mucus in the airways, because there are certain bugs that are more dangerous than others. Some need to be treated immediately, should be treated immediately, and others aren't so detrimental. So that's why we want sputum cultures every few months at least. And when there's an exacerbation, a flare-up, an attack, when the child's getting worse, we want to know immediately what's going on inside the lung, what is growing, what bugs we need to treat with what, which specific antibiotic as well.
Cool. So I think now we're going to move on to a question about hypertonic saline. Pam, so this person asked about when they've started with a dry or wet cough, is it advisable to inhale hypertonic saline with a nebulizer at either 3% or 6%? And this person's also talked about using xylitol and hyaluronic acid inside that hypertonic saline and whether they could test the nebulization to see if that would help eliminate the cough. So what do you think about that?
Yes. So we know that there's no evidence at this stage in bronchiectasis about the xylitol and the other acid. Sorry, I've lost the name. And there's very limited evidence about hypertonic saline at the moment. That there has been a little bit of work done, and it is given for some children, but again, it depends on the physiotherapist. So I would be very careful not to start it on my own, but have a talk to your doctor and the physiotherapist and see if they think that might be something worth trialing. So it's not a no, but it's with caution and under the direction of your team.
So we have another question, very similar to the previous ones. My child has bronchiectasis. Can they play sports, or are there some limitations? And Zena, you have a good experience to think.
Yeah, I think that if they're physically able to, then yes, they should be absolutely encouraged to play sports and things. But I think you have to look at the child in each individual case. So in our case, Ed's great at playing squash and indoor sports, but actually in the winter, in the dead of winter, when it's really frosty and really cold, or when it's very damp, he really struggles playing outside, not necessarily on that day, but then you almost get an exacerbation the day after or days after. So it's just trying to, so we tried to avoid, so we never played football or rugby in the winter. We didn't go and do those things on a Saturday like lots of parents go and stand at the sidelines. We didn't do that because it was just, we knew he'd get an exacerbation. So we just adapted it. So he still did sport, did something different. So did squash. He swam a lot when he was younger as well because it's inside. It's just trying to find suits your child.
Do you think, Pam, there is any type of sports to avoid in these conditions?
I think one of the things that comes to mind is a contact sport if the child has the infuser port. So that's just something to consider. But I don't know how many children. It's not that common for children with bronchiectasis to have that port, so that you would be careful with that. And if you're actually having your IV antibiotics and you've got a long line in, then you need to be very careful. You're a lot more limited. But generally speaking, if it's a safe, you're safe and you're puffing and you're enjoying it, or you're getting stronger, go for it. You just should absolutely go for it. I think if a child is very, very sick, and then we've got worries about their, they're not getting enough oxygen, then that's very different. But I think generally speaking, for a child that's out there in the community, go for it.
But as Zena said before, many parents are worried during the winter season to sending their child outside, and it's raining, it's cold.
Yes, so
what do you think about this?
So that's probably not a good question for me from Australia. We don't have we don't have that problem. There's no snow where I come from, so we can exercise all year round. I think the cold is something. I'm probably not the best one qualified to answer this. Maybe the doctors that are from Europe should be answering this. I think it's wise to keep warm and maybe with indoor options. And if it's very cold outside, I wouldn't want to go out there and exercise. So
yes, some children can be very sensitive to cold air and doing exercise outside, and they will actually catch a cold. So yes, we can be careful. Coming from Austria, we have very cold winters sometimes.
Well, here in Rome is quite similar to Australia these years. So we can exercise outdoor most of the year. Only, I think, 2 months, maybe December and January are a little bit colder, but our climate is warm here in Rome, in Italy.
Angela, we've now
I mean,
got...
I think if...
Sorry, keep going, Pal.
Sorry. No, it's okay.
Okay. So, Angela, we've now got a question about infections, and this person's wondering how is Pseudomonas aeruginosa the infection treated, and if there's anything that can be done to eradicate or prevent reinfection.
Yes, very important questions. This is a type of bacteria that we take very seriously. And if we detect Pseudomonas in the lower airways, we want to treat it because we want to get rid of it, because it's a bug that will damage the lungs. And also it can stay inside, and if you don't treat it early, you might not get rid of it anymore. So it needs to be taken seriously and needs to be treated. There are two ways, basically. If you find it within the airways and you don't have many symptoms, you might want to go for an option of taking oral antibiotics and doing inhalations with antibiotics. So you inhale the medicine into your lungs, and that's very effective, and it's a good way of getting rid of the Pseudomonas inside your lung. If, on the other hand, you already have quite a few symptoms, so you're already having a deterioration of your lung status, then we actually recommend having it treated in hospital with IV treatment and then with inhalations of antibiotics afterwards.
Okay, and then back to Laura. Flare-up exacerbation. How often can a child with bronchitis experience flare-up in a year time? And there are differences between small children and infants, or school children or adolescents.
Well, it's a difficult question because the rate of exacerbation varies a lot from patient to patient, and within the same patients varies a lot from a season to another and from 1 year to another. So it really depends on the singular case. But we can say that in younger children, sometimes it's hard to distinguish from all the viral infections that are typical of this age group. So distinguish between viral infection and flare-up, so exacerbation. So it's important to teach parents to recognize the exacerbation and treat as early as possible with the appropriate antibiotic. And if they are quite unsure, to contact the treated clinician to seek for advice, because it's important to discriminate the viral infection from the flare-up, and sometimes it's quite hard. So there is no clear answer to this question because it really depends from the cases. Okay.
Thank you. Zena, we'd like to add something to this question. I know it's not your question, but there's a difference between infancy and childhood nowadays in regarding bronchitis and their flare-up in Ed. Did you notice any differences?
Yeah, absolutely. When he was little, he was definitely in that circle, and he was coughing for 10 days, well for 10 days, and it just constantly. But by lots of things that we've done, we hope, and recognizing it, then we've managed to break it, and now it's much that the exacerbations are maybe for longer now, but they're much more spaced out. So he might only have 1 or 2 exacerbations a year now, and that was unheard of when he was little. I mean, it was constant, and So that's really good. And now they're mainly in the winter. You can almost tell around Christmas time he's always kind of ill, and maybe again January, February. So but absolutely for us, you can definitely see, and I think you're right about catching lots of infections when they're little. He was at nursery, and so caught lots, and but it's got better. So yeah.
Okay, thank you.
Zena, do you think you could talk a bit more about any tips or tricks that you've found to improve my symptoms outside of exercise?
Yeah, I mean, this might not work for anyone, but it might not work, might work for others. I don't know. But what we found is that Ed sleeps on a wedge. So it's an orthopedic wedge that people buy for raising their feet in bed or something like that. And he sleeps on that and has done for probably the last 10 years. And that really helps. So he's not coughing at night, which used to wake him up and things like that. He's got really, really good hygiene, particularly about bringing up secretions, and the physio taught him that. I know it's common sense, but we were using a hanky and things, and it's just tissue. So he always carries a packet of tissues, throws it away. He washes his hands frequently. He always carries water. So it's little things, but these make a massive difference. And he also, like you've said as well earlier, keeps away from people who are ill. If there's somebody coughing and sneezing, he stands the other side of the room. I know it's not trying to be rude. It's just trying to keep himself well. And likewise, he doesn't stand near smokers or anyone vaping. And we'll walk on the other side of the road. We will actually cross the road to people, particularly if you're in a cafe outside or something and they're sitting at a table. We will walk on the other side of the road. It's just tiny little things, but all these little things hope add up and make him as well as he is today.
And Angela, for you, the last question now. Can you give some advice regarding vaccination and vitamin supply for subjects with bronchiectasis? Anyway, small and even adults.
Yes, well, get all the vaccinations that are available. Also, the flu vaccine is really important every year. Get your jab, and also for adults, that there are vaccinations that all healthy adults need to get every few years. So this can help protect your child or your adolescent with bronchiectasis. So that's really important. Do everything you can to stay as healthy as possible. And Zena has summed it up really nicely. What can be done? These easy things, common sense things. Do those. Hand hygiene, avoid illnesses. Also, in times of flu, maybe also avoid large groups of people, and lead an active life with lots of exercise. And with children, I mean, they like to move around, so you just need to go with the flow with them and try to also make it enjoyable for them. As Pam said, it needs to be something they want to stick to.
Okay, Laura, would you say something about vitamins and nutrition? Just a few words.
Yeah, so it's important to control vitamin D intake. So it's important to check this vitamin. There is no clear evidence for other malnutrition, but it's important to check the nutrition status of your child. So try to stay as healthy as possible also with the diet, and avoid the possible malnutrition of micro and macronutrients.
Okay, I would like to say something for encouraging physiotherapy.
Yeah, I think it's trying to develop that routine is really important. So it's about developing the rigor, if you like, so that it becomes habit, but also trying to make it as fun as possible. Yeah.
Okay. And Zena, would you like to give a good advice for our children and for parents too?
Yeah, I think like just Pam said and everyone said, it's just finding something that they actually enjoy doing, you know, and actually getting them to do an active life. Like you talked about singing and small children and nursery rhymes and things. Ed sings in lots of choirs now. It's all those things and it's active, you know, yeah, and it's just trying to find them. We encouraged him to do the Catch 5K. My husband ran alongside him. It was hard work. I'm not trying to deny that. In the first few weeks, it was really, really hard. But by persevering and getting through, he's so much better now. So yeah, it's just finding what they enjoy.
So I would like to thank you. Thank you everyone for your hard work with us today, and we hope we have managed to answer some of the questions. There are other questions we hope to answer them on our website. I would like to thank the ChildBearNet and the European Lung Foundation for their help in organizing this webinar, and you can visit our websites for more information. Thank you. Please, Ed.
Thank you, Ami. Yeah, I'd just like to echo the thank yous that Ami said. Firstly, to Ami himself for being such a great co-host, and to our panel of bronchiectasis experts, Angela, Laura, Pam, and Zena. To all our ChildBearNet colleagues for their support, and to the ELS staff who are behind the scenes today, so Ellie, Jeanette, and Claire, and also to you guys for joining us today. Just a quick reminder that all the talks and everything that we said today has been recorded, and we aim to get them up on our website next week, and we will notify all delegates by email. We will include links to the ELF and ChildBearNet websites and resources in our follow-up email after the event, which will also have a link to a feedback form so you can let us know how today went. So thank you so much everyone for being here today, and we hope you have a great rest of your day. Thank you.
Bye.
Bye-bye.
Bye.
Bye. Bye.
Bye.
Bye all.